Good afternoon, dear viewers and participants. My name is Antonio Bunum. I'm a European Trainee Forum member from Zagreb, Croatia, and I would like to welcome you all to the TACE ETF webinar on the topic of basic IA procedures. We have two excellent speakers with us today, Anne-Marte Schroeder-Arsen and Lasse Rovik, both from Norway, who will provide us with an intro into basic interventional radiology procedures, together with a case interpretation quiz, which we will conduct via the Slido platform. Therefore, this will be an interactive webinar.
I'll be showing you some of the basic endovascular procedures in interventional radiology. So endovascular procedures, meaning inside of blood vessels, are a minimally invasive treatment option. So arteries and veins, though similar in the way that they do transport blood, they have different properties which need to be addressed when being worked on. And there is a rapidly growing list of available endovascular techniques and procedures, including the ones you see here. Today, we're going to be focusing mainly on arterial angiography, PTA, and embolization, which in many ways are the bread and butter of endovascular procedures. So the angiography we saw is going to be our first case of the day, which was an 83-year-old woman with intermittent claudication of her left leg. She experienced immobilizing calf pain after walking just 20 meters. So what would be our treatment of choice?
Dr. Anne-Marte Schroeder-Arsen, who is also an ETF member and an interventional radiologist from Norway, working at the Oslo University Hospital. Her topic will be biliary interventions and transarterial chemoembolization procedures. Please, Anne-Marte, you may begin with the talk.
Thank you, Antonio. So thank you for inviting me to talk about biliary interventions and TACE. And thank you, Lasse, for a very good presentation and a very fun quiz. So we will just jump right into this. The main part of my talk will be to tell you about percutaneous transhepatic biliary drainage, known as PTBD, where the goal of the procedure most often is to place an internal-external biliary drain through the skin, through the biliary ducts, crossing a stenosis at some point and ending with a pigtail drain here in the intestine, usually the duodenum. Next topic, I will discuss TACE with you also briefly. Transarterial chemoembolization is usually performed in patients with HCC. It is a palliative treatment. It can be curative in the way that it can be a bridge to liver transplantation and also if used in combination with ablation. There are two types of TACE. Originally developed in the 80s is the conventional TACE, where the mixture of chemotherapy with lapiodol, which is an oily contrast agent, and this is injected into the tumor feeding arteries, often followed by injection of embolic agents such as gel foam. A more modern approach to the technique is the DEB-TACE, with injection of drug-coated or drug-eluting beads, usually loaded with doxorubicin into the tumor feeding arteries. And this gives the combination of both the chemotherapy effect and also the occlusion of the feeding vessels.